Welcome to the world of medicine, where a decade of training meets complaints about the color of a surgeon's Crocs. We've found the most absurd grievances ever filed against doctors and nurses, stories from people who face down mortality and decide the real emergency is the font on their bill. Let's get into the 55 dumbest complaints ever made. 1. A man facing life-or-death heart surgery decided the surgeon's biggest flaw wasn't his skill or decades of experience, but his choice of footwear. He filed a formal multi-paragraph complaint against a top cardiologist for wearing bright orange Crocs. His logic was that a man with such frivolous and unprofessional taste in plastic clogs was fundamentally untrustworthy to operate on a vital organ. Apparently, he expected his surgeon to be wearing Italian leather dress shoes in the operating room. 2. After a trip to the ER for a severely broken arm, one man was absolutely furious with the staff. His complaint? The brand new cast they had just applied was defective because his arm still hurt. He approached the nurse's station, holding up his immobilized limb and genuinely arguing that the cast was supposed to function like a painkiller, instantly eliminating all sensation upon application. He demanded they remove the broken one and install a version that actually worked as advertised in his head. 3. A woman arrived for her appointment with a simple cough, having already diagnosed herself online with a rare, bioluminescent fungus found only in the deepest Amazon rainforest. When the doctor examined her and concluded it was just common bronchitis, she became outraged. Her official complaint accused the physician of being arrogant and unwilling to accept patient-led research. She wasn't seeking a diagnosis. She was seeking a cosigner for her exotic, internet-fueled fantasy of being medically interesting. 4. A patient's 8 a.m. surgery was canceled because he violated the fasting from midnight rule by eating breakfast. He was livid. His defense was that he had only eaten healthy food, a kale smoothie and avocado toast. He passionately argued the no-food rule was obviously for unhealthy things like bacon, and that healthy calories don't count before major surgery. 5. After a successful, life-saving triple bypass surgery, a man's biggest takeaway was the poor quality of the in-room entertainment system. His entire complaint centered on the television remote, which lacked a dedicated one-touch Netflix button. He claimed that being forced to use the simple arrow keys to navigate to the app caused him significant and unnecessary emotional distress during his fragile recovery period, completely overshadowing the fact his heart was, still beating. 6. A patient filed a complaint that her doctor was being condescending simply by using the language of his profession. His great offense was using basic medical terms like prognosis, inflammation, and outpatient. She felt these were trick words used to make her feel stupid and insisted he should be forced to use regular people words. This left the entire medical staff wondering how to professionally document that the big OE is getting less puffy and you can go home soon. 7. While a nurse was trying to take a patient's vital signs, the patient launched into a long, detailed story about her sister-in-law's messy divorce. When the nurse politely tried to get the appointment back on track to discuss actual medical symptoms, the patient was deeply insulted. The resulting complaint stated the nurse lacked basic human empathy and was an awful listener, angry that the medical professional wasn't also acting as a free, on-demand therapist for her unrelated family drama. 8. During a busy flu shot clinic, one man refused his vaccine at the very last moment. His reasoning wasn't a fear of needles or any known conspiracy theory. He loudly announced to the entire room that the needle was unacceptably shiny and therefore looked suspicious. He insisted to the baffled nurse that a dull, matte-finish needle would have been perfectly fine, but the high-gloss version was clearly a sign of some kind of nefarious government trick. 9. After a routine and successful appendectomy, a woman was absolutely horrified to discover it had left a scar. She filed a formal complaint against her surgeon for cosmetic disfigurement, claiming he never explicitly warned her that cutting a person's abdomen open would leave a permanent mark. She genuinely seemed to believe that modern surgery was a traceless, invisible process and demanded a refund for the shocking aesthetic damage caused by saving her life. 10. Waking up from general anesthesia can be disorienting, but one man's primary feeling was one of profound disappointment. He complained to the recovery nurse that the anesthesiologist had failed to provide him with any interesting dreams. He genuinely expected a fun, psychedelic journey, while he was unconscious for his knee surgery and instead just got boring blackness. His official feedback was that the hospital should offer a dream menu for patients going under the knife. 11. A new mother, after a perfectly healthy and successful delivery, called the obstetrician back into the room with a look of serious concern. Her complaint? The newborn baby didn't look enough like the ultrasound photos. She felt the blurry, black and white 3D images had promised a much more defined chin and a cuter nose. She was genuinely treating the birth of her child like a disappointing online purchase that didn't match the promotional pictures, accusing the doctor of engaging in a classic case of medical false advertising. 12. Sometimes the problem isn't incompetence, but the exact opposite. An elderly female patient filed a complaint against her male nurse because he was distractingly handsome. She wrote that his good looks made it difficult for her to concentrate on her symptoms and that his charming smile was unprofessional. She formally requested a more average-looking nurse for the remainder of her stay, effectively punishing him for having a face that was too pleasant to look at. 13. During a routine blood draw, a man watched the nurse fill a small vial with his blood and became increasingly agitated. His complaint wasn't about pain or a fear of needles. He accused the phlebotomist of taking too much of his blood. He was convinced she was hoarding it for a secret government experiment or stealing his life force. The nurse had to patiently explain that the tiny vial contained less than a teaspoon, an amount his body would replace before he even got back to his car. 14. One patient's complaint had nothing to do with her medical care, but everything to do with the other people in the waiting room. She wrote a detailed letter listing the unforgivable offenses of her fellow patrons. One man was breathing with an arrogant rhythm, a child kept looking in her general direction, and another woman's perfume was offensively cheerful. She demanded the clinic start screening patients for personality to ensure a more serene ambiance for her. 15. An elderly patient complained his modern, motorized hospital bed was as complicated as a fighter jet cockpit. He claimed the multi-button remote was giving him performance anxiety. His formal request was to be moved to a room with an old-fashioned manual crank bed because he didn't want to have to learn a new skill just to take a nap. 16. A doctor prescribed a perfectly normal, effective medication for a patient's condition. A day later, the patient called the office, furious. The problem wasn't side effects, it was geometry. The pill was an oval shape, and he had a deep-seated belief that only round pills are trustworthy. He claimed that oval pills were deceptive and unnatural, demanding the doctor find him a circular alternative. He was willing to compromise his health over a baseless superstition about pill shapes. 17. In the world of pediatrics, you see it all. A mother brought her toddler in for a checkup and later complained that the pediatrician had startled her child's aura by placing a cold stethoscope on his back. Not that the child cried or even flinched, but that the sudden temperature change had caused a severe spiritual imbalance that would require a visit to their energy healer. The doctor, a man of science, was now getting feedback on his performance in the metaphysical realm. 18. The classic hospital food complaint gets an upgrade. A patient recovering from a minor procedure lodged a formal grievance about his dessert. It wasn't that the Jell-O tasted bad. It was that its color was an aesthetically displeasing shade of red. He wrote that it was clearly more of a cherry hue than a raspberry, which he felt created a visual clash with the green plate it was served on. He was critiquing the meal's presentation like a food blogger, completely ignoring that its primary purpose was being easy to digest. 19. The overhead speaker in a hospital announced a code blue, a term for a medical emergency like cardiac arrest. A patient in a completely different wing, hearing the alert, pressed her call button to complain. Her issue: the term code blue was too negative and depressing. She suggested to the nurse that the hospital should rebrand its emergencies with more uplifting names like Code Sunshine or Code Opportunity to improve the building's overall vibe. 20. A man received a multi-page, itemized bill for a lengthy hospital stay, detailing costs that ran into the tens of thousands of dollars. His formal written complaint, however, had nothing to do with the astronomical charges. He was deeply offended by the font used on the document. He wrote to the billing department that Times New Roman is a lazy and uninspired typeface, and that an institution of their caliber should use a more elegant and respectable font, like Garamond. 21. A surgeon received a complaint from a patient's adult son who was furious that the hospital staff wasn't following his mother's recovery plan. The plan in question? A strict regimen of celery juice, crystal energy alignments, and a toxin-flushing podcast he'd found on Spotify. He accused the nurses of being closed-minded big pharma shills for insisting on giving his mother her prescribed blood pressure medication instead of the all-natural tinctures he brought from home in an unmarked bottle. 22. A doctor was stumped when his patient furiously claimed his new, state-of-the-art asthma inhaler was a useless piece of plastic. The medication was highly effective, so the doctor asked the man to demonstrate his technique. Instead of putting the device to his mouth, the patient held it out in front of him and sprayed a puff into the air, like a can of air freshener. He then took a normal breath. His logic was that the inhaler was meant to medicate the immediate atmosphere, creating a personal cloud of healing air that he could passively breathe in. His complaint was that the cloud disappeared too quickly, calling the product a defective and overpriced room spray. 23. A patient recovering in a top-floor room of a major city hospital filed a complaint about the view. It wasn't that the view was bad, it was that the panoramic cityscape was too interesting. He wrote that watching the endless hustle and bustle of traffic and pedestrians was preventing him from getting the rest he needed. He claimed the constant activity outside his window was mentally exhausting, and formally requested a room facing a calm and inspiring brick wall instead. 24. You can't even be good at your job without someone complaining. A patient filed a formal grievance against a nurse because her handwriting on his chart was suspiciously neat. He wrote that her perfect, clear penmanship lacked a human touch and seemed robotic, making him question if she was truly paying attention or just filling out forms on autopilot. He was genuinely more comfortable with a doctor's illegible scrawl, believing that a messy signature was the true sign of an authentic, hard-working professional. 25. A doctor, trying to build a friendly rapport, made some small talk and asked a patient what he did for a living. The patient answered curtly and, a week later, filed a formal complaint. The grievance stated that the doctor's question was an inappropriate and invasive attempt to gather personal information that was not relevant to the diagnosis of his sinus infection. He felt his professional life was confidential and the doctor was prying for no good medical reason. 26. A woman in post-op recovery complained that the nursing staff was too efficient. Her written feedback noted that the nurses would come in, professionally check her vitals, change her IV bag, ask if she needed anything, and then promptly leave to care for other patients. Her complaint? They didn't linger and chat long enough. She felt like a task on a to-do list, and was upset that the busy nurses weren't providing the level of social companionship she expected as part of her care package. 27. One patient, a classically trained musician, complained that the steady, life-affirming beep of his heart monitor was causing him profound psychological distress. He claimed the tone was a quarter-step flat of a B natural, and the resulting dissonance was giving him anxiety. He seriously asked the nurse if a technician could come and retune the machine to a more harmonious pitch, like A440, so he could recover in a more melodious environment. 28. After a minor hernia repair, a surgeon told his patient to take it easy for a few weeks. When the patient returned for his follow-up, having made almost no progress, the doctor was confused. It turned out the patient had interpreted "take it easy" as achieve a state of near total paralysis. He had refused to do anything, including the gentle walking and prescribed physical therapy exercises, for fear of violating doctor's orders. His complaint was that the doctor's vague instructions had made him weaker. 29. A patient about to undergo a minor in-office procedure complained that the surgeon's hands were too clean. After the doctor entered the room from scrubbing in, the patient recoiled, stating that the faint smell of antiseptic soap was a harsh chemical odor. He told the stunned doctor that he would prefer a physician with a more natural, earthy scent, implying that the very foundation of surgical hygiene, sterilization, was suspicious and untrustworthy. 30. A man placed on a mandatory clear liquid diet after abdominal surgery became incensed with the quality of his meals. He called the nurse into his room to complain that the beef broth lacked a developed umami profile, and the lemon jello had a one-dimensional flavor. He then lectured the nurse on the proper technique for creating a French consommé, demanding to speak with the kitchen manager about their substandard ingredient sourcing. He was critiquing the menu like a Michelin inspector. 31. A patient refused examination from a highly qualified doctor for one reason: the doctor had a beard. His official complaint called facial hair an unsanitary facial accessory, where germs could hide, essentially labeling the physician a walking biohazard. He demanded a clean-shaven and therefore more trustworthy doctor. After a decade of medical school, this doctor was being judged by the hygiene standards of a 19th century barber. 32. One patient treated the emergency call button like a hotel concierge bell. Nurses would rush in to find her asking for the TV channel to be changed, her pillows fluffed, or even help with a crossword puzzle. When confronted, her complaint was that the nursing staff had a poor attitude about customer service and showed a shocking unwillingness to assist with recreational problem-solving. 33. When a nurse asked a man the standard question, "Any allergies?" he became deeply offended. He filed a grievance, calling the query insulting and accusatory. In his mind, asking about allergies was like suggesting his body was weak and defective. He was proud of his lack of allergies and felt the nurse was trying to undermine his superior genetic makeup by even suggesting the possibility. 34. A patient's antibiotic came with a "may cause drowsiness" warning. He called back furious, not because of the infection, but because the drowsiness wasn't strong enough. He admitted he was hoping the side effect would be a free cure for his insomnia. His complaint was that the medication was only curing his infection and failed to work as the powerful sleeping pill he'd been hoping for. 35. A patient lodged a formal complaint about the hospital's free Wi-Fi. The signal was excellent, but he was deeply offended by the network name, Patient Guest Access. He wrote that this name was cold, clinical, and lacked empathy, making him feel like a nameless data point instead of a person on a healing journey. His official suggestion was for the IT department to rename it to something more encouraging, like Healing Hotspot, to improve patient morale. This was his most significant piece of feedback after a 3-day stay. 36. During a routine reflex test, a patient accused the neurologist of assaulting him with a weapon, the little rubber hammer. He explained that cartoons taught him this tap causes an uncontrollable kick, and he was terrified the doctor had activated his leg's attack mode. He refused the rest of the exam, convinced his own limb had been weaponized against his will. 37. After a 6-figure heart surgery, a man received his bill and complained, not about the cost, but about the paper quality. He wrote to the CFO that a bill of this magnitude arriving on cheap, flimsy copy paper was deeply disrespectful. He argued that such a massive debt should be presented on heavy premium cardstock to properly honor the financial burden he was under. 38. After getting an X-ray for a potential wrist fracture, a woman was shown the image on the screen by the technician. Her response was not relief or concern about the bone, but pure vanity. She complained that her skeleton looked unflattering in the picture. She seriously asked if they could retake it from a better angle because she felt the image made her clavicle look fat. She was treating a critical diagnostic tool like a bad Instagram photo that needed a new filter. 39. One patient found the standard automated blood pressure cuff to be a source of deep personal offense. He filed a grievance claiming the machine was emotionally aggressive and that its tightening sensation felt passive-aggressive and judgmental. He wasn't upset with the nurse, but with the perceived bad attitude of the inanimate device. His written suggestion was for the clinic to invest in cuffs that offer a more nurturing and supportive hug to the arm during readings. 40. After being fitted with a walking boot for a severe fracture, a patient demanded other options because the gray medical device was aesthetically unacceptable. He had a formal wedding to attend and was appalled the clinic didn't offer the boot in tuxedo-compatible patent leather, or at least discreet evening black. His primary concern was that his essential medical equipment was going to clash with his cummerbund. 41. A man received an itemized bill for a complex 5-day hospital stay that totaled over $50,000. He sent back a long, irate letter to the billing department. He wasn't contesting the surgical fees or the cost of his room. He had circled a single line item, a $7 charge for a pair of non-slip hospital socks, and demanded it be removed, calling it an egregious example of predatory capitalism. He was perfectly fine with the cost of saving his life, but the price of the socks was an outrage. 42. Just before a minor procedure to remove a mole, a patient watched the surgeon mark the spot with a sterile surgical marker and immediately recoiled in horror. He later complained that the doctor had desecrated his skin with graffiti before the operation even began. He was less concerned about the impending incision, scalpel, and stitches, and more offended by the small, temporary purple dot, which he termed pre-surgical vandalism. He wanted the area to remain pristine right up until the moment it was cut open. 43. After a routine checkup, a doctor informed a man his blood pressure was dangerously high. The patient didn't just disagree, he was personally insulted. He argued it was impossible because he was an extremely calm and laid-back person. He genuinely believed that blood pressure was a direct measurement of one's personality, not the physical force of blood against artery walls. His complaint was that the doctor's faulty machine was misrepresenting his chill vibe and slandering his character. 44. In a packed emergency room, a man with a sprained ankle watched as a cardiac arrest patient, who had arrived after him, was rushed back for immediate treatment. He then stormed to the triage desk to complain that the staff had let someone cut in line. He furiously argued that he had been there first and the hospital should respect the first-come, first-served rule. He was trying to apply the sacred laws of the deli counter to a life-or-death medical situation. 45. A doctor instructed a patient recovering from hernia surgery not to lift anything heavier than 10 pounds. The patient called back a week later, complaining of severe pain. After some questioning, the doctor learned the man had been walking his 120-pound Great Dane every day. When confronted, the patient's defense was flawless. "I'm not lifting him, he's pulling me." He was genuinely unable to grasp that his abdominal muscles didn't care who was initiating the force. 46. One patient's biggest source of distress during her hospital stay wasn't her illness, but her IV pole. She filed a complaint that the clumsy metal tree of sadness was ruining the room's entire aesthetic. She claimed its utilitarian design disrupted her energy flow, and that its squeaky wheels were an assault on her inner peace. Her formal suggestion was that the hospital should invest in decorative artisanal IV poles that better complemented the room's feng shui. 47. A doctor was carefully explaining a complex diagnosis to a patient when the patient's wife interrupted, looking annoyed. Her complaint, filed later, was that the doctor spent too much time directing his explanation at the patient. She argued that since she was the one who would be managing his medication schedule and diet, she was the primary stakeholder and should have been the focus of the conversation. She essentially saw her husband's illness as a project she was managing, and the doctor wasn't reporting to the right boss. 48. A woman diagnosed with a painful case of shingles was absolutely horrified by the name of her condition. She complained to the doctor that it sounded like a common roofing ailment and was completely undignified. She refused to tell her friends what she had and demanded to know if there was a more elegant or French-sounding medical term she could use instead. She was less concerned with the agonizing nerve pain and more with the public relations of her illness. 49. A patient complained her room was too cold. A nurse promptly brought her a warm, thick blanket. A few minutes later, the call light went on again. The patient's new complaint? The blanket was too heavy and felt oppressive. The nurse, ever patient, found a lighter, fluffier blanket. 10 minutes later, another call. The new blanket was not substantial enough. She was essentially the Goldilocks of hospital linens, and nothing was ever just right. 50. After being admitted for observation, a man's primary feedback was on the staff's uniforms. He complained that seeing all the nurses in the same solid blue scrubs was monotonous and psychologically demoralizing. His written suggestion to the hospital board was that they should implement themed casual Fridays for the medical staff, like Hawaiian Shirt Day, to create a more festive and healing atmosphere on the ward. 51. A patient in a beautiful, east-facing private room with a stunning view complained that the hospital was assaulting him with an aggressive sunrise every morning. He claimed the sudden and intense morning light was disrupting his sleep schedule and filed a formal request to be moved to a west-facing room so he could experience a gentler, more compassionate afternoon sun. He was, in effect, lodging a complaint against the planet's rotation and expecting the hospital administration to do something about it. 52. Technology is great until it's too efficient. A patient received an alert that his lab results were available on the hospital's online portal. He logged in, saw a single number flagged as slightly outside the normal range, and immediately panicked. His complaint wasn't about the result itself. It was that the hospital had irresponsibly released raw data before his doctor could call him to soften the blow and explain it with the proper emotional context. He was angry he got the information he wanted, but a few hours too soon. 53. A doctor placed a patient on a strict low-sodium diet. At the follow-up, the patient's blood pressure was even higher. When questioned, the patient proudly explained his method. He had eaten all his favorite processed foods, canned soup, frozen pizza, deli meats, but had meticulously avoided using a salt shaker. He genuinely believed the doctor's order only applied to adding salt, and that the massive amounts of sodium already baked into his food existed in a sort of dietary loophole. 54. A patient filed a complaint about her doctor's unprofessional office decor, citing a single item as the source of her concern: a framed family photo on the corner of his desk. She wrote that seeing the doctor with his smiling wife and children made him seem distracted by his personal life and unable to give her medical problems his full, undivided 100% focus. She was essentially complaining that her doctor was a complete human being with a life outside of her sinus infection. 55. After being brought back from cardiac arrest with a defibrillator, one patient's main feedback wasn't gratitude, it was a performance review. The complaint centered on the doctor operating the machine, who was described as unnecessarily loud and aggressive. The life-saving shout of "clear" was specifically cited as panicked and unprofessional, with the patient feeling the entire experience should have been conducted in a calmer, more soothing tone of voice. And that's proof that while a medical team fights for your life, someone's fighting for better Wi-Fi. Now, for a controversial question, when is it okay to be the difficult patient? Tell us in the comments about the time you had to become that difficult patient in a hospital, but were 100% justified. If you enjoyed this, hit like and subscribe for more proof that common sense is on life support.